Hello everyone. Today we will discuss about the intellectual disability. Intellectual disability is identified by significant limitations in both intellectual functioning as well as adaptive behaviors. Why? Because these two are very important when it comes to this intellectual disability. The intellectual disability has been classified right from mild to profound. Limitations in mental abilities affect intelligence, learning, and everyday life skills. Some people may experience minor effects but still live independently. Others may have severe effects and need lifelong assistance and support. A common misconception is that the intellectual disability is just a limitations on intelligence as assessed by a simple IQ test. It is just a piece of information. And some people have an average and above average of IQ but still have trouble with other abilities necessary for their life, as vice versa. The intellectual disability is the general mental capacity that involves reasoning. Intelligence is the general mental capacity that involves reasoning, planning, solving problems, thinking abstractly, comprehending complex ideas, learning efficiently, and learning from the experiences. This is what the intelligence definition is in general mental capacities. That means, so if a child is having average then above is IQ, that must the child has to have that reasoning, planning, as well as solving problems, thinking abstractly, comprehending complex ideas, difficult, the ideas as well, learning efficiently. It has been identified by the significant cognitive deficits which has been established through a standardized measures of intelligence, in particular with an IQ score of below 70, and also by significant deficits in functional and adaptive skills. The adaptive skills involves the ability to carry out age appropriate daily life activities. So intellectual disability is condition that limits intelligence and disrupts abilities necessary for living independently. Conditions appear during childhood, but it is lifelong. People need degree of assistance throughout their lives. Support might be required. Kind of programming should be prepared for them to support in terms of day-to-day activities. So this will obviously help in managing the symptoms and the effects. So DSM-5 suggests that, and also it defines the intellectual disabilities as neurodevelopmental disorders that begin in the childhood and are characterized by intellectual difficulties as well as in the conceptual, social, and practical areas of the living. DSM-5 diagnosis of IED requires the satisfaction of three criteria. The first criteria says that deficits in intellectual functioning, that is reasoning, problem solving, planning, abstract thinking, judgment, academic learning, and learning from the experiences. So this is confirmed by the clinical evaluation and individualized standard IQ testing by APA. So deficits in the adaptive functioning that significantly hamper conforming to developmental and socio-cultural standards for the individual's independence and ability to meet their social responsibility. The onset is of these deficits during the childhood. So what overall DSM-5 says that the child must have the proper performance or optimal performance in terms of this, the cognitive functioning as well as adaptive behaviors. The adaptive behaviors are where we can see on day-to-day life, where the child is able to perform well on domestic work. There are some symptoms and causes also. The symptoms of ID is, it revolves around trouble in academic, social and personal as well as domestic. So ID related other symptoms are slowed in learning, delayed of any kinds of activities either in the school, otherwise in the domestic work, reading difficulty, reasoning and logic, judgment as well as critical thinking, and distractibility or difficulty in the focusing. So these are the symptoms are related to the ID, intellectual disability. So the adaptive behavior is, it revolves around the abilities and learned skills you need to have to live and support yourself independently. So needing helping from the parent figures or caregivers with the basic daily activities. Difficulty in learning, doing house chores, common tasks of the daily life, trouble in understanding or the money management. Needing help in managing medications as well as healthcare appointments also. So trouble in knowing social boundaries, lack in social interactions. So these are the set of the adaptive behaviors where we can find some limitations in the children who have intellectually disabled or impaired. So there are some causes of ID, that is genetic as well as inheritance, infections, teratosomes and the medical conditions. So these are the obvious causes for the intellectual disability. So one among these, it might affect the child who is born. In terms of if it is genetic as well as inheritance, it says this, the many conditions that cause intellectual disability happens because of genetic mutations. Some of these mutations can be passed from the generation to the generations. Examples including the Down syndrome, Fragile X syndrome and Prader-Willi syndrome. So these are the genetic reasons or genetic causes which might transfer generation to the generations. Alongside, there is an infections. Some of infections like toxoplasmosis and the rubella can disrupt fetal development, resulting in conditions that can cause intellectual disability such as cerebral palsy. This is commonly known disorders in the children that to this intellectual disability. So teratogens are, these are the substances that can disrupt the fetal development. Examples including alcohol, tobacco, certain medications, radiation exposures and many more. So these things happens during the pregnancy where a mother is exposing to this certain aspect where it will obviously affect on the fetal. That means if a mother is drinking in alcohol or consuming alcohol, this obviously impact as well as affect to the fetal as well as tobacco and certain medications. Medication conditions, having certain medical conditions while pregnant can cause developmental differences in fetus. Those can later result in intellectual disability. Examples, it includes hormonal conditions like hypothyroidism. So these are the causes of ID. So causes that can happen during the birth also, that is lack of oxygen, hypoxia it is called as. So premature birth, other types of brain injury during the birth. So causes that can happen during the early childhood includes infections, common infection that spread to your nerve systems, and tumors or a growth in the brain, cancer in the brain or brain regions. So medical conditions such as seizures and various types of epilepsy such as lennox-gastaut syndromes can cause the brain damage. So there are some other causes also that contributed to this intellectual disability. They are ADHD, autism, impulse control disorder, mood disorders, especially anxiety disorders and depression. And the intellectual disability has a classifications right from the mild to the profound. The mild IQ level approximately 50 to 69. The DSM-5 criteria says that a child can live independently with the minimum levels of support. That means the caregivers or the parents has to support them in terms of to take as well as to take a participation in day-to-day activities, maybe in the school, otherwise in the domestic work. The moderate IQ level is about 36 to 49. So here the independent living may be achieved with the moderate levels of support such as those available in the group homes as well as schools. The severe intellectual disability, approximately the IQ range is 20 to 35. So here it requires daily assistance with the self-care activities and safety supervisions. So profound, it is below a 20 IQ. It requires 24 into 7 care from the parent as well as maybe a caregivers also. Yes.